服务中心主办。然后我们的合办单位是费郡的卫生局，还有Fairfax Falls Church 的社区服务委员会。那我们的agenda 就是总共我们有5次的讲座，这是我们的讲座的题目和我们的讲员以及时间安排。那接下来的时间，我们介绍一下今天晚上的我们 CCHS 是美国的一个501c3的非营利慈善机构，我们致力于健康服务的可及性和公平，在大华府地区开展各种公益性的社区健康服务。我们欢迎更多义工加入我们。这是我们的网址，还有我们的中文服务热线。我们中文服务热线是目前是非常方便的一个，你任何时间有问题，你都可以打电话来咨询。好，今天晚上的讲题是费郡青少年行为健康问题的现状。我们的讲员是 Jennifer Feltes，那他是一个 Fairfax County 卫生署的一个专门的做一个这个卫生的流行病学的一个分析做分析师。那他会做很多的这种行为的健康、心理健康问题的这种案例，然后他会做一个分析，所以做统计学的分析和流行病学的分析，他能够很准确的、简单明了的给我们介绍费郡目前的这种流行病学的现状。好，下面有请 Jennifer。So Jennifer, welcome. It's your turn.
Thank you so much, Lily. I'm so excited to be here this evening with you all. I'm going to go ahead and get my presentation set up and we'll go from there. Okay, can you all see the slides full screen as well as hear me all right?
We can hear you, but we cannot see the screen here.
Oh, you can't see the screen?
Not, yeah.
Okay, let's try this again.
Yeah, now we can see.
Now you can see? Okay. Hold on just a second. All right, and you can still see the full screen slides?
Yes.
Okay. All right. Well, thank you so much again. So my name is Jennifer Feltis, and I am an epidemiologist with the Fairfax County Health Department. My work focuses on data trends in both mental health and substance use within Fairfax County. And this evening, I'm joining you all to discuss Asian American youth mental health. So I'd like to start this presentation off with an introduction to mental health in general. So mental health is a very important part of our overall health and well-being, and it not only impacts our day-to-day experiences, but it can also lead to major life challenges and even premature death. And each person's mental health exists on a spectrum, like the spectrum you see before you, from healthy functioning and positive mental health at one end, all the way to mental health crisis on the other end. And at any point in time, a person's mental health could be anywhere along this spectrum. So what does positive mental health look like all the way on one side of the spectrum? So that looks like normal and healthy functioning. So a person might be energetic, they might be joyful, they're able to take care of themselves physically and be socially active and sustain relationships. So no one has a life completely free from stressors or challenges, but someone with positive mental health takes those challenges in stride. Further along the spectrum, a person might be in mental distress. So this person is going to be less able to cope with life's challenges, and they might feel overwhelmed at times. And here, prevention, such as getting better sleep or talking to a therapist, might be needed to help move this person back into positive mental health and keep this person from developing mental illness. Now, if a person has mental illness, they might need mental health treatment. So there's more than 200 types of diagnosable and treatable mental health conditions, some of which you might be familiar with, including major depression, anxiety disorders, bipolar disorder, schizophrenia, post-traumatic stress disorders or PTSD, as well as eating disorders, and many, many more. And it's also important to note here that many people with mental illness go undiagnosed or don't seek treatment for their condition. And this is due to many reasons, some of which we'll discuss later this evening. So on the extreme end of the spectrum is a mental health crisis. And a person with a mental health crisis needs emergency care to help stabilize them. And then long-term, they need support for their recovery. So it's really rare for someone to go from one end of the spectrum to the other immediately. So it's rare for someone to go to from positive mental health or mental distress all the way to a mental health crisis. There are many points along the way where self-care, strong relationships, and mental health services can help move someone back towards positive mental health. So in this presentation, I'm going to share with you data from many different sources, and they'll be demonstrating different mental health outcomes. And I want you to think of these mental health outcomes as falling along different points along this mental health spectrum. So for example, we're going to discuss residents of Fairfax saying that they feel stressed all the time, or that they feel sad or hopeless. Now, these could be signs of mental distress or perhaps an undiagnosed mental illness. If a person is receiving mental health treatment, likely that's for a condition that they have been diagnosed for. Now, if a person is considering suicide, that tends to be a rarer and more severe outcome. And the most severe outcomes that we'll look at together are when a resident attempts suicide or visits the emergency department for a mental health crisis. So let's next discuss the many factors that can affect our mental health, and in particular, the mental health of young people or youth. So both biological factors and environmental factors affect a person's mental health. And these factors exist at the individual level, the family level, the community, environment, and society levels. So, for example, if we're looking at the biological factors that affect the individual level, there are many mental health conditions that are affected by the genes that we inherit from our parents. So these genes might make it more likely for us to develop a mental illness in our lifetime, such as depression or schizophrenia, but that's not the whole story, and other factors come into play here as well. So for young people, we see on the family level that relationships with parents and other family members can impact mental health. Events such as domestic violence and trauma can also increase a child's risk of developing a mental illness. Now, going one level up on the community level, we see that young people's mental health is affected by their relationships with their friends, their teachers, their mentors, and how supported they feel at school. On the environment level, we can ask whether youth feel safe in their neighborhood. Do they have access to parks where they can exercise and help take care of themselves physically? Finally, on a society level, there are larger factors such as social and economic inequalities, discrimination, and racism. And we'll talk about the impacts of some of these factors later this evening as well. All right, so I am so glad that you're here with me tonight because mental health is a really timely issue. You've probably noticed that there's been a lot more media coverage and increased focus on youth mental health the past couple of years, and that's definitely for a good reason. You can see some of the headlines and reports from news pieces to the right. So the results from national surveys of youth have shown major increases in mental health challenges over the last decade, and especially over the last couple of years. So these challenges include symptoms of depression and thoughts of suicide, which we can also call suicidal ideation. These increases have been especially large among young girls, and this has generated a lot of discussion for what potential causes of these increases could be, from increased social media use to isolation and lingering effects of the COVID-19 pandemic. Now, let's move deeper into these trends and focus on the mental health in a group of particular interest to the community, which is our Asian American youth. And we can start first with some of the national data trends. So before we dive into the data, I do want to just briefly discuss the category Asian American, which I'll use for most of the rest of this presentation. And I do want to note that this is such a broad term for such a large and diverse community with so many different ethnicities, languages, religions, and different socioeconomic backgrounds. And so when data is collected and reported under the Asian American group, this hides differences in mental health outcomes within such a large and diverse community. So we know this to be the case. For example, there's an older study from 2015 that looked at rates of depression among Asian Americans of different backgrounds and found that Korean and Filipino Americans were more than twice as likely to have depression compared to Chinese Americans. So I wish that I had this kind of detailed data for the rest of the presentation, that this data was collected more regularly and available to us on mental health among our Chinese American youth specifically. I'm going to share with you the best data that we have at this time. So first, we have data on Asian American youth from the Youth Risk Behavior Survey. So this is a national survey of high school students that was conducted in 2021. And this survey found very high percentages of Asian American students who had seriously considered attempting suicide in the past year. These percentages were even higher when you look among female Asian American high school students specifically. So the female students in the chart that you're looking at on the screen are in blue, and male students are in green. And on the left-hand side of the chart, we have the percentage who reported that they had seriously considered attempting suicide. And on the right-hand side of the screen, we have the percentage that reported that they had attempted suicide in the past 12 months. So here we can see that 24.2% of Asian American female students and 11.8% of Asian American male students had seriously considered attempting suicide in the past 12 months. So we do see lower percentages of Asian American students who had actually attempted suicide within the past year, but we still see higher rates among girls. So we have 8.3% of Asian American female students that had attempted suicide within the past year. Now, when we compare these rates to other race and ethnicity groups, we actually don't see a lot of differences. So we don't tend to see lower or higher rates of suicidal behaviors among Asian American youth compared to youth from other backgrounds at the national level, based on the most recent data. Now, when we look at rates of mental health treatment among youth from different race and ethnicity groups, we do start to see some differences. So this is data from the National Health Interview Survey, which is a national survey of children ages 5 to 17. And again, this is the most recent data available. It was collected in 2021. Now, this survey found that 4.4% of Asian American youth received mental health treatment in the past 12 months, and 2.3% took mental health medication, and 3.1% received counseling or therapy. So you can see here comparing the Asian American youth, which are in the dark blue, to the other race and ethnicity groups. The Asian American youth were the least likely to have received any mental health treatment, took medication, or received counseling or therapy when compared with other race and ethnicity groups. So the question here is, why is this? So this does not necessarily mean that Asian American youth have fewer mental health concerns, as we saw with the data on suicidal behaviors on the previous slide. So if you can, right now, start thinking of some potential reasons why Asian American youth might be less likely to access or seek mental health treatment. So I just want you to think of some of those to yourself. So stigma surrounding mental health is definitely one factor, and we'll talk about this and the other factors, potential factors, in the second half of the presentation. So now that we've looked at national trends among Asian American youth, let's look at our most local data, the data on trends in our local Fairfax community. So one of the best resources that we have on well-being in Fairfax County youth is the Fairfax County Youth Survey. So I'm sure that many of you on this call have heard of this survey before. You might have even had a child participate in this survey. So this is an anonymous and voluntary survey that's administered every year to middle and high school students at Fairfax County Public Schools, or FCPS. The most recent data that we have from the Fairfax County Youth Survey was collected in the fall of 2022. The youth survey asks students questions on a wide range of topics, including mental health issues. Now, there's four main outcomes that they collect on mental health, and I'm going to show those to you now along the spectrum that we talked about earlier. So we have considering suicide and attempting suicide towards the bottom or the most extreme part of the spectrum. But then data is also collected on feeling sad or hopeless or feeling stressed all the time, which are some of those more upstream outcomes. And we can see that these fall along the mental health spectrum that we talked about earlier. And then I'll also mention that the youth survey data is reported combined for Asian American and Pacific Islander youth, but we know from demographic data on Fairfax County that the large majority of these students are Asian American specifically. So out of these four mental health outcomes, the most commonly reported outcome among Asian American or Pacific Islander students was feeling sad or hopeless. 26.8% of Asian American and Pacific Islander students reported feeling sad or hopeless for 2 or more weeks in a row over the past year. Now, this rate does not substantially differ from rates for other race and ethnicity groups, but it is still strikingly high. And I'll also mention that the 2022 percentage is actually lower than the rates that we've seen in recent years. So in fact, rates of feeling sad or hopeless had actually increased 46% from 2015 to 2021. So they went all the way up to 36.1% in 2021 before decreasing to 26.8% in 2022. So we do hope that this is the start of a trend, but we'll need more time to be able to tell for sure. The second most commonly reported outcome among Asian American and Pacific Islander students was feeling stressed all or most of the time. So 23.1% of students reported feeling stressed all or most of the time in the past month among our Asian American and Pacific Islander students. So this could be a sign of mental distress or coping challenges, or it could even be a sign of undiagnosed mental illness. We found that high levels of stress were more commonly reported among female Asian American and Pacific Islander students compared to males. So you can see here, 28.2% of girls reported feeling stressed most of the time or all of the time, compared to 16.3% of boys. And that's among the Asian American and Pacific Islander students specifically. So moving to the right on the mental health spectrum, we found that 9.5% of Asian American or Pacific Islander students seriously considered attempting suicide in the past year. So across the board, rates of suicidal behaviors were consistently higher year after year in Asian American and Pacific Islander students who are female, those who are non-binary or another gender, and those that were bisexual or gay or lesbian. So we see that students who are LGBT are often have additional life stressors such as bullying or lack of acceptance, and that can add to and worsen their mental health. But here we definitely see a continuation of the trend as well of worse mental health outcomes among girls. And actually, I'm going to go back to that note for a second, because now that I've brought this up, you're probably wondering why girls and why do we consistently see this? So it's not known for sure, but some of the theories are that girls can emotionally mature at an earlier age compared to young boys, and this can cause them to be more sensitive and therefore more vulnerable to developing anxiety and depression. So that's one of the theories out there, but in addition to several of the other factors that we mentioned at the beginning of the presentation on different levels. But we definitely see this trend, and it continues within the Asian American youth as well. So going to our last outcome here, the most severe outcome captured in the youth survey is attempted suicide. So 3.6% of Asian American and Pacific Islander students reported attempting suicide within the past year. And we do see some differences by race and ethnicity for this outcome. Rates of attempting suicide among Asian American and Pacific Islander students are higher than rates for non-Hispanic white students, but are lower than the rates for Black and African American and Hispanic students. I also want to call out that if you compare this local data to the data points that I shared earlier on suicidal behaviors for Asian American youth across the country, though we do see lower rates here of suicidal behaviors in Fairfax compared to the national rates. And so we can also ponder about why that might be. There's no single explanation, but it could be that population living here tends to be wealthier or has more support than those living in other areas. We also have seen an increase year after year in the ratio of mental health providers to residents living in this area, even though we know that mental health treatment capacity is still an issue. We do have more treatment capacity in this area compared to more rural areas. But that is something to think about as well, comparing these local rates to the national rates. So the second local data source that I'll share with you this evening is the electronic surveillance system for the early notification of community epidemics. And that is a mouthful that here at the health department, we just call Essence. So this is a great data source for us because it is near real time. It's a database of all of the emergency department and urgent care center visits that are happening among our residents and in Fairfax Health District. So the health department monitors this data closely, and we use the medical codes and the description of patients' chief complaints to identify ED visits that deal with self-harm, suicidal ideation, or suicide attempt. So I am first going to share data for youth overall. So this includes youth from all racial and ethnic backgrounds. In total, there were 923 ED and urgent care center visits for self-harm, suicidal ideation, or suicide attempt among adolescents ages 10 to 17 in 2023. So this is a really large number, and it's been increasing over time. This is a 64% increase compared to the number and rate in 2015. And the chart that I have shown in front of you shows the rate of ED visits over time for youth ages 10 to 17 in the blue, the top line, and then residents of all ages in green on the bottom line. And so you can see that the rate of ED visits for self-harm or suicide is always higher among youth ages 10 to 17 compared to residents of all ages. So now let's look at the rate of ED visits for suicidal behaviors among youth of different race and ethnicity groups in Fairfax. So the rate for Asian American youth is in red on this chart. We see that the rate of ED visits for suicidal behaviors among Asian American youth ages 10 to 17 is consistently lower than this rate in other race and ethnicity groups. But again, this does not necessarily mean that Asian American youth have less mental health challenges. So for the second half of this presentation, I would like to kind of change gears a little bit and now discuss some potential underlying reasons for mental health challenges experienced by Asian American youth in the Fairfax community. So there's 5 potential factors that we'll discuss this evening. We'll discuss cultural pressures, mental health stigma, a combination of social media, isolation, and lingering effects of the pandemic, discrimination and racism, and mental health treatment barriers. So the first factor is cultural pressures. Asian American youth report experiencing additional stress from parental pressure to achieve academically. And this might be related to a strong emphasis on family and a feeling of responsibility to achieve in order to provide financially for one's family as you grow up. And that can be a lot of pressure for a young person to hold. Asian American youth also report challenges in finding their identity when they're balancing multiple cultures. So they have their Asian culture at home and their American culture at school, and it can be difficult to kind of weave those together. The second factor is a big one, and that is stigma towards mental health. So Asian American youth report decreased comfort in talking about their feelings or mental health concerns with their family members due to mental health stigma. So for everyone on this call right now, I want you to take a moment to think to yourself, if you or your child or another family member had a mental health concern, how comfortable would you feel talking to them about it? Take a moment and think about that. It can be very hard for anyone to be open about these really personal and sensitive matters. And we see that borne out in the data. In fact, 17.1% of Fairfax County Asian American and Pacific Islander youth feel that they cannot ask their parents for help with personal problems. So Asian American families might also have challenges with recognizing the presence or severity of mental health concerns. Now, in a small study that presented Chinese American immigrant parents with mental health vignettes, the parents sometimes had difficulties identifying suicidality, and they also tended to identify social anxiety as just a personality difference or perhaps someone being shy. And then additionally, in a focus group of Chinese American high school and college students, over 87% reported hearing from family members that mental health was an American or a white concern. And 65% reported that parents referred to youth mental health concerns as not a real problem. So Asian American youth also report that stigma is a top barrier for them in choosing to seek mental health treatment. So this could be due to many different reasons. It could be based off of a fear that mental health conditions might be recorded and used against you, or perhaps fears about what other families might think if they found out that you or a family member was accessing mental health services. So think about whether you see a stigma towards mental health in your community. And also think about if you've ever personally put off seeking mental health treatment due to the stigma surrounding mental health. It's a really challenging issue. So this next set of factors is kind of a whole soup of things coming out of the pandemic and different technological changes. And these factors affect youth from all backgrounds, including Asian American youth. So in recent years, we have seen an increase in social media use among teens in the United States, as well as a corresponding decrease in in-person social connection. So meeting with a friend in person at a park, at a coffee shop, is less common than it used to be. And instead, folks are connecting through their phones over the internet on social media apps. So this can lead to some youth feeling isolated because the benefits that you get from that virtual connection are not the same that you would get from a full in-person connection. So this feeling of isolation can lead to mental health challenges in youth. There's other issues that come along with social media, such as cyberbullying and causing teens to compare themselves with one another. And this can be really damaging for teens' self-confidence, especially teen girls' self-confidence. And we know that cyberbullying is happening in our community. In fact, from the youth survey, we can see that 7.1% of Fairfax County Asian American and Pacific Islander youth reported experiencing cyberbullying in the past year. So not just bullying, but cyberbullying. And then all that increased time spent on social media can also lead to lack of sleep and poor sleep quality, which leads to poor mental health. So lack of sleep is actually very common among youth in Fairfax County. and our Asian American youth in Fairfax County. So in fact, and I found this to be a very startling percentage, but 43.6% of Fairfax County Asian American and Pacific Islander youth reported sleeping an average of 6 or less hours of sleep on school nights in 2022. So I don't know about you all, but when I get 6 hours or less of sleep, it's very hard for me to function the next day. Sleep is so crucial, especially for youth and their developing brains as well, and helping them deal with all of life's challenges and stressors and helping them to regulate their emotions. So related to this, the COVID-19 pandemic, which added a lot of new stresses to young people's lives. So of course, for a time, many youth were in remote learning, and this physical distancing that we all experienced early on in the pandemic led to additional social isolation. And so this was also a time of many economic uncertainties, as well as the deaths of loved ones. And it was a really challenging time for all of us, but especially for young people. And in fact, a national survey of Asian American adolescents and young adults found that 2/3 had increased depressive symptoms since the pandemic started. So another factor impacting Asian American youth mental health is discrimination and racism. So discrimination has been cited as a significant source of stress for Asian American teens. And locally, a large percentage, or 46.5% of Fairfax County Asian American and Pacific Islander students, reported having their race or culture insulted in the past year. I apologize, you might hear some sirens in the background. I'll let those pass. But on top of this, there has also been a rise in Asian American harassment since the start of the COVID-19 pandemic. And that's been documented. So in a 2021 to 2022 survey of Asian American youth and young adults, so more recently, a quarter said that the frequency or severity of their personal experiences of anti-Asian harassment had increased since the beginning of the pandemic. And this survey also collected data on feeling less safe and on depression symptoms. And this study found that this experience of harassment highly correlated with feeling less safe and increased depression severity among Asian American youth and young adults. So lastly, there are barriers for Asian American youth and families who seek to access mental health treatment. So first of all, it's difficult for Asian American youth to find a mental health professional that represents them, that looks like them and understands them. So there's a real lack of Asian American representation among those employed as mental health professionals. So only 3% of psychologists identify as Asian American. Also, many mental health professionals lack the training needed to provide culturally competent care, or care that understands a person's unique values, experiences, and personal beliefs. So in addition, language barriers can add challenges for families trying to access as well as navigate mental health treatment. A focus group of Asian American young adults living just north of us up in Montgomery County, Maryland, found that language barriers were a top concern in accessing mental health care and made things significantly more challenging for families. Lastly, are two challenges for all youth and families trying to seek mental health care. And those are insurance, cost, and as well as lack of treatment capacity. So you are probably aware that many mental health treatment providers don't accept insurance, which can lead to more costly care, as well as confusion about getting reimbursements. And while the ratio of mental health providers, as I mentioned, to residents in Fairfax County continues to improve year after year, there still are not enough services available for youth in this area. And the county is very aware of this. So I just shared a lot of information with you, but hopefully some of these factors that we discussed resonated with you, and they hopefully they help to explain some of the data trends too that we viewed together. So lastly, I would like to share some mental health resources that could end up being helpful for you or a family member. Oh, and I'd also like to mention that if you, that will make sure that these slides are available to you, so that there are some clickable links in these slides, and you'll be able to access all of those and click on these links to view these websites. So first of all, I would like to highlight the work of the current US Surgeon General, who is named Dr. Vivek Murthy. So the Surgeon General is known as the nation's doctor. This is the top health professional tasked with providing Americans the best scientific information available on healthcare. And Dr. Vivek Murthy released an advisory in 2021 centered on youth mental health. And that had several great recommendations for caregivers. To promote youth mental health, Dr. Murthy suggests that we can start by being the best role model that we can possibly be for our young people by taking care of our own mental and physical health. We can also focus on stable relationships, strong relationships. So help our kiddos develop strong, safe, and stable relationships, both with us and with other supportive adults. We can look out for those warning signs of distress, and remember to try to seek help when we think that it's needed. And really keep that line of dialogue open with kids as well, and do our best to try to have an open conversation about mental health, even when it's challenging. And then going back to the virtual connection and social media isolation that we mentioned, we can do our best to promote in-person social connection over virtual connection, because it really adds that much more value. Along those same lines, the Surgeon General also released an advisory in 2023 specifically on social media and youth mental health. So this advisory recommends that we encourage youth to be intentional about their use of social media, video games, and other technologies. And to be intentional, youth can ask themselves a series of questions to kind of check in with themselves about their social media use and their online use. And I think that this list of questions actually works great for adults as well. I plan on using this for myself, just to kind of gauge if I'm spending the right amount of time online and how I feel about it. How does what I see online make me feel? And am I online because I want to be, or because I feel like I have to be? So these are questions that all of us, including our youth, can use to try to be more intentional about their use of social media and technology. So another great tip from the Surgeon General is to focus on building healthy relationships with peers to combat isolation. And some ways to do that, such as through school programs and sports, community groups, and volunteering. So as I mentioned, these are clickable links within this set of slides. So you'll be able to access these links here to see the advisory reports that I mentioned. And you can see many more tips on these advisory reports. So I also wanted to provide some emergency and non-emergency mental health resources, most of which are specific to the Fairfax area. So in the case of an emergency, it's always good to have a plan and a list of services that you can call. So hopefully this can serve as a resource. So you can always call 911 in the case of a life-threatening emergency. In addition, the Fairfax County Community Services Board, or CSB, has mental health emergency services that you can call to make an appointment at, or just arrive directly at their main Merrifield Center. There are several additional resources listed here, such as the National Suicide Prevention Line, which everyone should know about. Instead of dialing 911 from that, a person can just dial 988. It's just as easy as that. And then they'll get connected to the National Suicide Prevention Line. And I've also listed some crisis response services here as well. For non-emergencies, the Community Services Board with Fairfax County sees youth and adults through their entry and referral services. And so again, here are the hours, and the phone number as well. So George Mason University also has a Center for Community Health that offers mental health services on a sliding fee scale. Lastly, Fairfax County Public Schools, or FCPS, has partnered with a company called Hazel to bring no-cost mental health teletherapy to all FCPS high school students. So with this slide specifically, each of these service names are links. So you can click on the names of each of these, such as CSB entry and referral services, to be directed to their website. I provided a final list of regional mental health services and support groups here, including the Northern Virginia Family Service. And then lastly, this website that I've linked here is also a great resource. It's from the Community Services Board, and it walks you through what to do if you think your child might have a mental health concern. And it presents many different options based on what's occurring, as well as phone numbers to call. So that is all that I have to share this evening. So I want to thank you all so much for joining me. And at this time, I think we can start the Q&A portion. So I'm going to stop sharing.
Yeah, if anyone has a question, you can unmute yourself or put the question in the chat. Here is a one question. It says number of percentage is shocking to me. I wanted to know why it is happening. I think one of the suicidal percentage is very high.
Yeah, absolutely. The numbers are really shockingly high. You know, even if they're lower here in Fairfax County than what we see nationwide, you know, any of these really severe outcomes is too many. So I think we don't know exactly why. Some of the factors that we talked about in the second half, I think, have led to increased discomfort among youth, so isolation, and the COVID-19 pandemic, as well as the factors unique to Asian American youth. But I agree, the numbers are really, really quite shocking. And I think we'll have to keep talking to youth and trying to learn from them and hear about their experiences, as well as continue to collect more data to try to learn more. Oh, I see another in the chat. Uh, you can absolutely have a copy of this presentation. I definitely want you to have that, and feel free as well, once you receive it, to share it with anyone you'd like. It's meant to be shared and accessed to be able to click those links. So we'll definitely make sure that that gets to everyone.
Okay, I will. Yeah, I will put in the chat about her presentation, and I will. We will also, if you register for this class, we will definitely send an email to everyone. Any question?
Hi, Jennifer. I have a question. I saw there's an increase of discrimination, or like a anti-Asian has increased the rate after the COVID. Is there any data showing comparison, like during the COVID and the recent? Is there any decrease of that, or like it's just, like a keeping increase or at the higher level recently?
That is such a great question. So the question is whether there's been a decrease since kind of the height of the COVID-19 pandemic in that anti-Asian American harassment and discrimination. And the answer to that is that I haven't seen any more recent data since the metrics that I reported, which were collected in 2021 and 2022. So I haven't seen any data from 2023, and as well as how that might be affecting youth's mental health. I am thinking that that data might be out there. Maybe not specifically how it affects youth mental health, but reports of discrimination and harassment. So I think it would be interesting to see if those had decreased since the height of the pandemic, and if that was having, a better effect, or a less awful effect on youth mental health. So that's a great question. The answer is I don't know specifically, but I can definitely look into it and see what I can find.
Yeah, thank you for your answer. We're just expecting the decrease.
Mm-hmm, mm-hmm.
Any question? I have actually, can I ask a question? I think we were talking about the Asian to which slide you were talking about, the to seeking for help, the rates is very low, is that right?
Oh, seeking? Yeah. Would you like for me to display that again?
Yeah, and
Okay.
I just have a question. Is there any Fairfax County Health Department will focus on this problem to do some to help or
Yeah, that's a really wonderful idea. So the Community Services Board is the main entity within Fairfax County that provides mental health services, and I know that they do a lot of tracking to see who is accessing their services. So I think it might be a good opportunity for us to partner with them and look at access data to try to address this problem specifically. So I think that's a great idea.
thank you.
Oh, I see a couple of other questions in the chat. So regional mental health services and support groups in other states. There's a question about whether those could be made available. Um, so with the way that mental health is provided in this country, there's, just a hodgepodge of resources in different areas, and they do tend to be, pretty locally based. So I'm not aware of any really comprehensive lists for other regions, but I can definitely look into that. Some of the resources that I listed on my slides are not specific to any one region. So for example, the 988 or the National Suicide Helpline, anyone in the United States can dial that. I can make a note to go through here and let you know which of those services are local and which can be used in other areas. And let's see, I see another question as well about the Hazel service offered through FCPS. So that's the teletherapy mental health services that FCPS is partnering with. There's a question about how a student accesses the service and whether it requires parental involvement. I unfortunately do not know the answer to either of those questions. The link or the name of the service in the PowerPoint slides is a link that takes you directly to their, I believe it's an FCPS overview, and it describes more the logistics of how a student would access that. So hopefully that question is answered there. In terms of parental involvement, I believe that it most likely does involve parental involvement, but I can double check on that. And I think that hopefully that should be explained on the FCPS website that's linked as well. So I'll make a note on that too. It's a great resource for FCPS to be starting. Okay. And then we had another question about connecting with me. So I neglected, I think, to provide my email address on my slides, but I can drop that in the chat right now. And I'm very happy to connect with anyone from this meeting offline and continue to talk about mental health. Let's see. So this is my email address. It's just my first name dot last name at fairfaxcounty.gov. You can feel free to email me. There's another question about the Surgeon General's suggested questions. Let's see. So for each of these questions, can talk more about an example of each scenario. All right, I'm going to pull or open the slides to get to that slide, and we can talk a bit more about each of these. Oh, I think I accidentally hit meeting summary instead. Okay, hopefully you all can see the slide that has the tips from the Surgeon General on being intentional about use of social media. So, okay, let's think of some examples here. So when asking oneself am I spending, or how much time am I spending online? And hopefully I'm answering this question correctly. You can stop me at any point if I'm not. But I think this would be a question that, you know, if a teenager had just spent 3 hours, you know, scrolling through TikTok, at some point you kind of feel tired from that, and that might be a moment in which the teenager could ask themselves, how much time am I spending on this? In particular, I know as well, I know that iPhones, I'm not sure if other phones have this capability, but you can track how much time you're spending on different apps, and then view that data back each week. And so that could be a good way for to start a conversation, honestly, for a youth to be able to track how much time they're spending on certain apps, and then think about if that is a healthy amount of time, or like it says in number 2, am I doing that at the expense of other activities, like exercising, seeing friends, reading, and sleeping? So if someone notices that they're spending a lot of time online and then they're not doing other things as a result, then that could be an issue. If the primary way that someone is connecting with their friends is through Instagram or a virtual connection, there's really less benefit that we as humans get out of that compared to meeting with a person in person. And then the next question, what content am I consuming and how does it make me feel? So I think this would be something to ask oneself. I know oftentimes on social media, there can be really shocking information that goes viral. It tends to be, you know, videos that will get a lot of views because they might be disturbing, or they might even spread, you know, misinformation about current events. And when you are viewing content like that, or if that's shared with you, it might be a second, or it might be a good idea to take a second to think about how that makes you feel. And if you find that it's causing you to be anxious or worried, then it might be worthwhile to try to forego it altogether. And then the last question, am I online because I want to be or because I feel like I have to be? So I guess it's just par for the course nowadays for most youth to have several different social media apps. So to have all these different, you know, Instagram, TikTok, to be able to connect with friends. And I think just taking a second to ask oneself, is that really necessary? Do you feel like you are online just because it's what everyone else is doing, or because it actually is adding a lot to your life? So I'm gonna stop sharing just so that I can see what's in the chat, but hopefully that helps to kind of add some more context to those questions and show how they can be useful for all of us, not just youth.
Yeah, so far we don't have any more in the chat box.
Okay.
Thank you so much. That's very helpful.
Yeah, absolutely. Thank you so much for welcoming me this evening.
Yeah, I think, you know, people all understand we have a problem, but we really don't have a very reliable statistic and source.
Mm-hmm. Mm-hmm.
But this is very important for us to understand the situation.
Absolutely. Yeah.
So Asian parents normally always focus on the study and the scores.
Mm-hmm.
So for emotion control, or sometimes it could be very different, and kids and experience all different cultures. American culture is more openly, so they
Mm-hmm.
feel so different at home, or they feel their parents didn't love them enough as others, or maybe I don't know. It's just
Mm-hmm.
so, I don't know. Is there anybody who want to? Think the school should provide a program. There's one more in the chat.
Mm.
Actually, it's a suggestion.
I see the suggestion. Oh, there's a question for
Oh,
future sessions.
yeah. And will there be data about college students later during our meeting? Do you have like college students data?
Um, so some of the data that I shared this evening, whenever I said youth and young adults, that included college students. So we do see a lot of the same things in college students that we see in younger teenagers with regards to Asian American mental health. Um, we have less data about college students specifically, beyond those from the more academic studies, for Fairfax County, because of the youth survey being such a great resource, local resource, and that just being middle school and high school kids. Um, so we have less data on college students specifically.
So how do you use those data? Do you put recommendation to the school board, or?
Yeah, so I can speak just from personal experience. Right now, I'm on a committee meeting with many different other agencies to identify gaps for youth mental health. We're trying to pull together all the different data sources that we have to see where the biggest challenges are, and then make recommendations, and also try to offer more services through the county. So perhaps through CSB as a result. So yeah, we definitely hope to put this data to good use. Another use of some of this data is in kind of strategic planning. So the health department has done a lot of work with community members, trying to identify what, the top concerns of community members are with regards to all areas of health. And that work is definitely underway still, but mental health is always a top concern of community members. So just helping us to set priorities for future programming.
So it looks like you've been collecting some data yourself, is that right? County just
Um,
collecting some,
do you mean the health department
yeah, health
specifically?
department, yeah.
Yeah, so I haven't specifically like conducted surveys yet in my role. I know others at the health department have held focus groups and things, so collecting data. Um, I tend to do more work with some of the data sources that I mentioned, where it's surveillance data, so it's coming from sources that the data was already collected, so like the emergency room data. But yes, the health department does collect data from community members on their health.
So the emergency room, it's a local data. It's not a
Yes.
nationwide.
Yes, it's local data. So, all emergency room visits, we can look at it two ways. So either all of the emergency room visits happening at Fairfax County facilities, so located in Fairfax County. And we can also look at the data for people who live in Fairfax County. So even if they go to emergency departments elsewhere in Virginia. So we're always reviewing that data to try to see what different trends are.
Yeah, that's very helpful.
Yeah, it's a great resource for the health department, and we can look for many different things. So not just suicidal ideation, but we can also look at visits for panic attack and anxiety. We're figuring out more of how to do that. And then we use it for many different other conditions like opioid overdoses. So not just mental health outcomes.
So yeah, from the chart earlier, I saw during the pandemic, the mental health issue surging very sharply, and the start from 2003, it's decreased. That means back to normal, or it's not back to normal. At least I think as like at home, it's a bigger impact for youth. So.
Here, I'll share the chart that you're mentioning so that I can pull it up on the screen. Yeah, so we do see a slight decrease in youth in 2023 in the number of visits for self-harm or suicidal ideation. And it's funny, you can see across all ages, though, we don't see a decrease. So with just one data point here, it's hard to tell whether this decrease will be sustained among youth. Whether we're going back to normal, as you mentioned, but we'll definitely be monitoring that. It would be great to see that continue and become a trend.
Any question? Share the slide about the future meeting schedule. Yes, yes, we will send future meeting schedules through the emails. Okay. Thank you, Jennifer, again. If we don't have any question, we can end a little bit earlier. We
All
really
right.
appreciate it. I'm so happy to have you here to update us with a very accurate data, especially from local government.
Absolutely. And now that well, you have my email address, but now that the attendees have that as well, we can continue the conversation.
Yeah, I think we should periodically use data to show, everybody, give us, at least give our community members updates.
Absolutely.
Okay. So thank you, Lily.
Thank you.
Yeah. So Lily, do you want to show other people? Because we will have another 4 sessions in the future.
Yeah.
So
I saw comment in chat and ask for the agenda.
yeah.
这是你要的吗？刚才那个 CC。
So yeah. Okay. Yeah, we record the presentation. We will put it on our website. It's a CACHS in few days. So you will have this recording.
如果你扫码加入我们我们 CACHS 的心理群的话，我们会在群里面再通知，会提醒你。
Yeah,
对，因为其他的，因为我们这一次没有再建一个单独的微信群，所以如果你愿意扫码进入这个群，我们会提醒。
thank you.
其他的所有报名的人，我们都会发 email，会发2次 email 来提醒，会在提前1天还有当天发2次 email 提醒大家。
非常感谢哈，想再确认一下，就是 I want to make sure. So in the website, you're going to also post the record of a presentation.
我听不太清楚你说的，你能不能说大声一点？
好的，不好意思，我想请问一下，就是说整个这个 presentation 的录音，请问也是会贴出来吗？在群里？
对，整个的这个recording 就是整个的这个，你可以点开，可以重看。
好的，太感谢了，谢谢你们的辛劳。
没事。
Yeah, many thanks. Thank you so much.
Okay, so thank you. Thanks again.